You ever, looked at blood test results and felt completely lost in the jargon?
Oh, absolutely. Like trying to decode a secret message sometimes.
Exactly. And sometimes there are these um, hidden clues that something important might be going on.
Right. Our bodies definitely have ways of signaling things.
So today, let's grab the key for one of those signals. We're doing a deep dive into paraproteinaemia.
Also known as monoclonal gammopathy. Sounds complex, I know.
It really does.
But basically it just means there are some unusual proteins floating around in your blood.
Okay, unusual proteins. Let's unpack that. What exactly are these paraproteins?
Well, think of your immune system, right? It makes antibodies to fight things off. Paraproteins are essentially faulty antibodies, or sometimes just parts of antibodies.
Multi-how.
They're all identical copies, mass-produced by a single group, a clone of B cells, usually plasma cells. So monoclonal just means they all come from that one single clone.
Ah, okay. So one type of cell just starts making tons of the same antibody protein.
Exactly. And paraproteinemia is the umbrella term for conditions where this happens.
Got it.
These cells often secrete a load of this identical immunoglobulin, sometimes called the M component or M protein.
A component.
And it's important to know, paraproteinemia isn't just one single disease. It's really a spectrum.
A spectrum, meaning...
Meaning it can range from something called MGUS monoclonal gammopathy of undetermined significance, which is often asymptomatic, basically harmless on its own,
Okay.
all the way to being a sign of serious conditions like multiple myeloma or Waldenström macroglobulinemia.
Right, so it could be nothing much, or it could be a precursor to something significant.
Precisely. It's a clue we need to investigate further.
Okay, that clarifies the what's. Now let's get into the why. What causes this? This is where you said it gets really interesting.
It is, because the causes are so varied. We can group them, though. Firstly, there are malignant conditions. These are the ones we worry about most.
Like myeloma.
Exactly. Multiple myeloma is the big one. But also MGUS itself, because of that potential to progress. Then there's Waldenström's macroglobulinemia, amyloidosis, CLL chronic lymphocytic leukemia,
Okay.
lymphoma, the rare heavy chain diseases, and Poem syndrome, too. Quite a list.
Definitely some serious conditions there. Are there less serious causes too? Benign ones?
Yes, and this is sometimes surprising. You can see paraproteins associated with non-lymphoid cancers like colon or breast cancer.
Really?
Also certain infections like CMV or hepatitis and autoimmune diseases, RA, SLE, that kind of thing.
Autoimmune, okay.
Then there are miscellaneous syndromes. Schnitzler syndrome is one: chronic hives, fever, bone pain, usually with an IgM paraprotein.
Wow.
And finally, other non-malignant systemic diseases can be linked. More autoimmune conditions like scleroderma, some skin issues like pyoderma gangrenosum, liver disease, even infections like TB or bacterial endocarditis.
That's an incredibly broad range of potential triggers.
Right.
Is there usually one clear cause?
Often, no. The exact reason can be uncertain. It seems to be a mix of genetics, environmental factors, and maybe other underlying health issues someone has.
Okay, so complex picture. Given all these potential causes, who is actually more likely to develop paraproteinemia? What are the risk factors?
Good question. Age is a major factor. It definitely becomes more common as people get older.
Right.
It's also seen a bit more often in men. A family history of plasma cell disorders, like myeloma, increases risk.
Makes sense.
And as we touched on with causes, having certain autoimmune diseases like lupus or chronic infections like Hep C or HIV are also risk factors.
Okay.
There's also some evidence linking it to exposure to certain chemicals or toxins, and specific genetic abnormalities might play a role too. So a mix of things, really.
Age, gender, family history, other diseases, environment, quite a few things. So how does this actually work inside the body? What's the pathophysiology?
So the core mechanism is that uncontrolled growth, the clonal expansion of those plasma cells or B lymphocytes we talked about.
Right, the cloning.
Yeah. And this clone pumps out large amounts of the abnormal monoclonal protein, the paraprotein.
And what does that protein do?
Well, it's not inert. It can interfere with your normal immune function, maybe making you more susceptible to infections.
Okay.
It can also directly damage tissues and organs, and it can disrupt normal blood cell production in the bone marrow.
So it can cause problems in multiple ways.
It can, and the specific effects really vary depending on the underlying cause and the exact type of paraprotein.
Okay. So if a doctor finds these proteins, what other conditions might they need to rule out? What's the differential diagnosis?
When we see a paraprotein, we need to think broadly. It could be a reactive thing. Sometimes your body makes more proteins temporarily in response to infection or inflammation.
Ah, okay. Not necessarily a permanent clone.
Potentially, yes. We also consider other lymphoproliferative disorders, conditions involving lymphocyte overgrowth. And of course, other specific plasma cell disorders like multiple myeloma itself are high on the list. And then there are rarer genetic things like Pohmann's syndrome. So it's a process of elimination and specific testing.
Like detective work. How common is this overall? What does the epidemiology look like?
Well, exact UK prevalence figures are a bit hard to pin down, but we know it's much more common in older adults. The prevalence definitely increases with age.
Right.
And interestingly, some specific plasma cell disorders, myeloma especially, are more common in certain ethnic groups, like individuals of African American descent.
Is there a general figure?
Yeah, studies suggest it affects around 3.2% of people over the age of 50.
3.2% over 50. That's actually quite a lot of people walking around with this.
It is. It's definitely not rare in that age group, even if many don't have symptoms initially.
So what are the signs or symptoms people might notice, or that might make a doctor suspicious? What are the clinical features?
It's really variable. As we said, many people, especially with MGUS, have no symptoms at all. It just gets picked up on routine tests. But if there are symptoms, they can be quite general fatigue, weakness, or more specific things like bone pain, getting infections frequently, maybe unusual bleeding or bruising. Kidney problems can cause symptoms. Neurological issues like numbness or tingling in hands or feet. Sometimes enlarged organs, non-specific things like fever, just feeling generally unwell, malaise, and that bone pain often comes up.
Bone pain seems key.
It's definitely a red flag. There are several key indicators that should prompt screening for an M protein. We can actually use a mnemonic to help remember them. Think BRAINS.
BRANS.
Okay.
What does that stand for?
So B is for bone disease or back pain. R for renal impairment kidney issues. A for anemia or pancytopenia, low blood counts.
Right.
I for recurrent infections. N for neuropathy, particularly peripheral neuropathy. And S is a bit of a catch-all for other symptoms like fatigue, hypercalcemia, high calcium, confusion, weight loss, maybe hyperviscosity causing headaches.
BRAINS, bone, renal, anemia, infections, neuropathy symptoms. That's actually really helpful.
It can be a good prompt, yeah.
Yeah.
If you see those features, think about checking for a paraprotein.
So if B or NS flags it up, what investigations follow?
The workup usually starts with blood tests. Serum protein electrophoresis, SPEP, is key to spot that M protein spike.
It's a PEP.
If that's positive, then immunofixation electrophoresis, or IFE, identifies the specific type of paraprotein.
Got it.
Urine tests are also crucial. Urine protein electrophoresis, UPEP, looks for those light chains, Bence-Gens proteins.
Blood and urine. What else?
Often a bone marrow biopsy is needed. That involves taking a small sample of bone marrow, usually from the hip bone, to look directly at the plasma cells.
Right, to see the source.
Exactly. Imaging like X-rays, CT, or MRI might be done to check for bone lesions or organ involvement, and then various other tests to check organ function, kidneys, liver, and look for complications like high calcium or anemia.
How do you use all that to tell if it's, say, benign MGUS versus something like myeloma?
That's the crucial differentiation. Generally, benign processes tend to have no evidence of myeloma-defining features, so no significant bone marrow involvement, none of those BRAINS symptoms caused by the protein.
Okay.
Also, the level of the M protein in the blood is usually lower and stays stable over time. You typically don't find light chains in the urine, and the levels of the other normal immunoglobulins in the blood are usually okay.
So a combination of factors.
Absolutely. You need to test both blood and urine, look at the bone marrow, and assess for any related organ damage or symptoms. It's the whole picture.
Right. So once you have that picture and a diagnosis, how is paraproteinemia managed?
It really hinges on the underlying cause and whether it's causing problems. For asymptomatic MGUS, for instance, it's often just active monitoring.
Watchful waiting.
Exactly. Regular checkups to make sure it's not progressing. But if it's myeloma or if there are complications, then treatment is needed.
What kind of treatments?
It can range from chemotherapy, immunomodulatory drugs, targeted therapies that zero in on the abnormal cells, sometimes stem cell transplantation.
So some quite intensive options there.
Potentially, yes. And supportive care is vital too, managing bone pain, preventing infections, treating anemia or kidney issues. The plan is always very personalized.
Tailored to the individual. Makes sense. What about the long-term outlook? The prognosis.
Again, highly variable. It depends entirely on the specific condition. MGUS can remain stable for decades, never causing trouble.
It's reassuring.
It is. But other conditions, like myeloma, are more serious. Prognosis depends on the stage, the patient's age and overall health, specific genetic features of the disease, and how it responds to treatment.
Are there general statistics?
Well, for multiple myeloma, the 5-year survival rate has improved a lot, but was around 52% in 2020. For MGUS, the main thing is a risk of progression. It's about 1% per year, risk of transforming into myeloma or a related disorder.
1% a year. So low, but not zero. Hence the monitoring.
Precisely. That long-term follow-up is key for MGUS.
And what are the main complications that can arise besides progression?
Well, progression to myeloma or Waldenström's is the big one we monitor for. But the paraprotein itself can cause organ dysfunction. Kidney failure is a major concern.
What, in BRAINS?
Exactly. Increased susceptibility to infections is common. Bleeding disorders can happen, neuropathy, that nerve damage, and then, of course, side effects from treatments can be complications too.
So managing it is also about preventing these issues.
Very much so. Early detection and appropriate management are crucial for minimizing complications.
This has been incredibly clear, thank you. Just to wrap up, what are the absolute key takeaways about paraproteinemia?
Okay, main points. It means abnormal monoclonal proteins in the blood. It
Wow.
stems from a clone of plasma cells, or B cells. The causes range hugely, from benign MGUS to malignant myeloma. Investigations like SPEP, IFE, UPEP, and often bone marrow biopsy are needed to diagnose and classify it. Remember BRAINS for clinical clues.
BRAINS, got it.
Management is tailored, could be monitoring, could be active treatment. Prognosis varies widely, and early detection helps manage potential complications like kidney damage, infections, or progression. And MGUS needs that long-term follow-up due to the small but real progression risk.
Excellent summary.
It
It
really
makes you
is.
think, considering this wide range of conditions linked to paraproteinemia, what other maybe seemingly unrelated symptoms might actually warrant a closer look at blood proteins? Something to ponder.
Definitely food for thought. And for anyone listening who wants to reinforce their knowledge on this or other topics for exams like the MSRA, do check out pastthemsra.com.
And there are free resources too, right?
Yes, absolutely. FreeSSRA.com has lots of great free content as well.
Perfect. Well, thank you for that incredibly insightful deep dive. And thanks to all of you for tuning in. Until next time, take care.